Here comes to correcting abnormal alar-columella relationships, ACR. Now, I will highlight the role of COG threads in improving nasal aesthetics and function. The alar-columella relationship, ACR, is a critical aspect of nasal aesthetics, influencing both form and function. It refers to the proportion and alignment between the columella, the tissue separating the nostrils, and the alar rim. Any imbalance in this relationship can lead to an unnatural or disproportionate appearance, often requiring correction through surgical or non-surgical interventions. Abnormalities in ACR can be categorized into two primary issues: overshow, when there is excessive exposure of the columella; undershow, when the columella is retracted or insufficiently exposed. These conditions may arise due to congenital factors, trauma, or previous surgical alterations, and they can be effectively addressed using advanced aesthetic techniques, including COG threads. Overshow occurs when the columella is too low, leading to an unbalanced nasal tip projection. The alar wing is too high, sometimes appearing angulated. A common cause is a weak lower lateral cartilage, LLC, which compromises structural support. Traditional correction often involves the use of a batten graft to reinforce the LLC and restore proportion. COG threads offer a minimally invasive alternative to support and reposition the nasal structures, enhancing projection and balance. On the other hand, undershow is characterized by a low-positioned alar wing, contributing to a retracted appearance. A weak or retracted columella, often due to loss of support in the distal septal cartilage. Structural weakness in the medial crura of the LLC, necessitating a strut graft for surgical correction. In non-surgical treatment, COG threads can provide structural reinforcement, lifting the nasal tip and improving the columella show. This is a special case of type 6 ACR deformity, most common type of ACR disfigurement in Asian nose. The columella is retracted with overhanging of alar. We used COG thread to strengthen and augment the columella and strengthen the alar and rebuild the support. The columella plays a critical role in nasal aesthetics and function. Proper support and augmentation can enhance projection, improve definition, and create a more balanced nasolabial profile. COG threads provide a minimally invasive option for reinforcing this region, offering an alternative to conventional cartilage grafting. COG threads can serve as a strut-mimicking graft, supporting the columella similarly to traditional cartilage grafts. The goal is to create a structured yet natural lift to enhance tip projection and stability. The ideal placement for columella support is on the nasal spine. However, in some cases, achieving direct contact with the spine may not be necessary. A floating strut technique, where threads provide adequate vertical support without direct anchoring, can still yield excellent results. For optimal structural integrity, multiple COG threads should be used. A minimum of 6 to 8 threads is recommended to ensure sufficient reinforcement and long-term stability of the columella support. Determining the upper limit of thread placement is crucial. Excessive augmentation can lead to unnatural results or compromise nasal harmony. Proper planning ensures a well-balanced transition between the columella and tip projection. The lower TDP is a key aesthetic and structural landmark. COG threads contribute to the precise definition of this point, enhancing nasal contour and symmetry, ensuring proper alignment with the nasal spine and tip cartilages optimizes the final outcome. A well-defined columella lobular angle is essential for an aesthetically pleasing nasal profile. COG threads can be strategically placed to refine this angle, preventing excessive retraction or drooping of the nasal tip. Here is how we do for the columella correction by threads. Insertion via entry puncture site at the tip and go in between the LLC at the center of the columella and straight ahead onto the nasal spine if possible. There are several traditional rhinoplasty grafts that we can adopt to be mimicked by thread treatment. Let's go for some. First is alar batten graft. Purpose: reinforces the lateral nasal wall to prevent nasal valve collapse. Indication: useful for patients with nasal obstruction due to alar collapse. Placement: typically positioned over the lateral crus of the lower lateral cartilage, LLC. COG threads, used to provide additional support and stabilization, enhancing structural integrity. Second is alar contour graft, alar rim graft. Purpose: enhances the definition and curvature of the alar rim. Indication: addresses alar retraction, asymmetry, or concavity. Placement: positioned along the alar margin to restore natural contour. COG threads assist in refining contour and improving soft tissue support. Thread is alar spreader graft, lateral crural spanning graft. Purpose: supports and widens the nasal valve region. Indication: treats internal nasal valve collapse and enhances airway function. Placement: positioned between the lateral crura of the LLC to create a stronger lateral wall. COG threads provide additional lateral reinforcement that helps the function of the nose instead of just aesthetic improvement. COG thread threadment can also deliver the result of composite alar rim graft and lateral crural onlay graft. We can insert the threads in the above diagram. The two main directions: lateral crural strut graft in posterocranial direction and alar contour graft, or the alar rim graft along the rim of the soft tissues. We again insert via the tip entry site and then divert posterocranially for the crural strengthening and along the rim for rim enhancement. This is the case example of overlying alai and slightly retracted columella. You can appreciate the improvement of the ACR with better aesthetic nostril shows and tip projection. Oh yes, the case also underwent nasal correction by thread. You can readily notice the higher dorsal height. Please notice the strengthening of the alar LLC by thread can improve nasal tip projection and reduce the width of the wings. This is another case in clay mode. You can see the narrowing of the nasal alar wing by alar thread correction.